My name's Dr. Kurt Coffman. I work at Arizona Veterinary Dental Specialists here in Phoenix. I started practice over 20 years ago, been doing just veterinary dentistry in a specialty sense for almost 15 years now. We have 4 locations throughout the state of Arizona, and each one of them has the Schick software and sensor system. Digital sensor system is amazing in that it's easy to use, and you start taking radiographs in cases that you didn't think that you would. And so when you look at return on investment, it happens before you even think about it, because each patient needs dental x-rays. And then you find things with those radiographs that you wouldn't have found otherwise. And so there's an additional source of income from just treating the patient for what they need. When we were taking images with standard film, we could definitely see more below the gum line than just with our eyes during exam. But when we made that leap to digital, we could see it much faster. You have that image readily available. You can take it with you in a laptop sense or a tablet sense, or if you're networked, take it right into the exam room and show the pet's owner. And when they see that problem, they're much more likely to go ahead and go for treatment. A lot of times the patient comes in, the owner doesn't even really see the pain or realize that the patient is in pain because they hide it so well. Recently we saw a patient, and it was a little white dog that was in to just do a cleaning and take x-rays, but that dog had actually had some health problems that the owner couldn't figure out why. Not eating as good, it had some pancreatic issues, indigestion. And then we did a cleaning, we didn't notice anything particular, and then the lower first molar actually had a significant abscess around the root. And so we treated that tooth, we did a root canal and a restoration. Once that had healed, that dog never had any of those pancreatic issues or digestive issues ever again. And we wouldn't have found it without the dental x-rays. Schick software allows you to change and manipulate the image in a real-time sense. It has settings that will allow you to look specifically at periodontal disease or endodontic disease. You don't have to use magnification with your own eyes. One of the big things that we like is to take the postcard, which is essentially a screenshot of the images that we're seeing with the patient. We export that, tag it on to an email, and send it right to the referring vet. So to use anything other than digital imaging in your veterinary dental office is really looking at something that's from the past. I absolutely would recommend the Schick 33 sensor and the software that goes with it. We've used Schick for over 15 years. We were one of the first veterinary offices in the country to use it. It says a lot that we've stuck with Schick for all those years because they've given us good service, because their hardware is good, because their software is good. They come through for us.